Hello, everyone, and welcome to our question lab. We're happy to have you here as we discuss renal pharmacology today. Leading our discussion today, once again, is Dr. Paras Vakaria, and he's going to introduce himself now.
Thank you, Sean. Hey guys, my name is Paras. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back home to Michigan to do medical school. I also work as an RX coach with USMLE-Rx, so I work one-on-one with students to help prepare them for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
And we're happy to have you here. We also have some wonderful panelists joining us this evening. If you look at your GoToWebinar control panel, you'll see a question box, and you can ask our panelists questions, and they'll do their very best to try to answer those questions for you. We have Rebecca, Kate, and Jeff, who you'll meet later. Brian, who's joining now, and Alec, who's here. And Alec will introduce himself now.
Hey everyone, my name's Alec. I'm a fourth-year medical student at Cooper Medical School in New Jersey. I've been with RX since about August, and I look forward to answering all your guys' questions tonight.
Excellent. We're happy to have you here as well. My name is Sean. I've been with RX Coach for over 2 years, working with our coaches like Alec, Brian, and Paras, along with and helping students like you to help them accomplish their academic goals. And we'll talk more about RX Coach a little bit later this evening. But what you should know is the methodology we're going to employ this evening as we do these 4 questions on renal pharmacology. It's going to be the same methodology that we use in RX Coach. So without any further delay, let's go ahead and get into our first 4 questions on renal pharm. As you can see, the answer choices are covered up, and that is by design. We covered those answer choices up because we do not want those answer choices to dictate or guide your thought process, and we don't want you to see an answer choice that you may be unfamiliar with, which may cause you to panic as you're trying to answer the question on test day. Once we cover up the answer choices, we will begin by reading the lead-in. The lead-in is the last sentence or the question itself, so we'll do that now. The most likely prescribed medication has which of the following physiologic effects on renal tubular function? The most likely prescribed medication has which of the following physiologic effects on renal tubular function? And we read the lead-in first to make sure you can know what the test writer is asking. This way, when you read the vignette, you can pick up on those relevant clues and prevent yourself from having to waste time and reread the question on test day. And then after that, we'd like to ask our attendees and our students how many steps they believe the question will require. An example of a 1-step question could be where you're asked for the diagnosis. An example of a 2-step question could be where you're asked for the treatment for a diagnosis. An example of a 3-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. So with those examples in mind, please let us know in the question box how many steps you believe this question will require. I see a couple first-time attendees. We want to welcome you here. I also see some people jumping ahead and typing in the answer in the question box. Keep in mind that it's important to be consistent and follow our process step by step. This is not a race. We want to maximize your points and your success. Now that we've done that, let's go ahead and read the vignette. A 52-year-old man comes to his primary care physician for a routine examination. Blood pressure is 150/90. He is diagnosed with hypertension and pharmacotherapy is started. 2 months later, the patient comes to the clinic with fatigue. Blood pressure is 125/80. Laboratory tests show hypokalemia and hypercalcemia. The most likely prescribed medicine has which of the physiologic effects on renal tubular function? I want all of you to start thinking about the important and relevant clues in the vignette as well as the stem as I hand it off to Paras.
Thank you, Sean. So we'll kind of show you what we think are the important clues in the vignette and the lead-in. So, anytime you're given demographics, it's always important to make note of that. The age, is this a male or a female? Because that'll really start to give you some clues as to what you should be thinking, what kind of things you can start to rule off. So always make note of that demographic information. We're also told why he's coming in. We're told that, what his diagnosis is. He started on medication. And obviously, as we got to the vignette, or, how we started with the lead-in, we knew that this is primarily about the medication. So it's important to take note in that vignette about any clues that could tell you what that medication was. They're obviously being vague because that's something we need to figure out. So are there any clues in that vignette? And as you can see, there are maybe a couple clues that we've highlighted that are important to make note of. So then looking at the lead-in, you can see here other things to mention is, of the most likely prescribed medication, physiologic effect of it on renal tubular function. So they're specifically asking about one specific thing, the effect on renal tubular function. So how many steps is this question? Well, I think one, we need to figure out what that prescribed medication is. Two, based on that medication, we need to know the mechanism of that medication. How does it act? And then three, based off that mechanism, what will be the effect on renal tubular function? So I think we have a nice three-step question here. One, figure out the drug. Two, know the mechanism. And then three, how does that mechanism affect renal tubular function? So let's go ahead and take a look at those answer choices. And we have 5 answer choices here. And what I'm going to do is I'm going to go ahead and read them out loud to you guys. But what I'm going to do is I'm going to start at the bottom, answer choice E, and I'm going to work my way up to answer choice A. And we recommend that students do this as well. The reason we recommend this is because a lot of times we'll see students who start at the top, they'll see something they like and they'll select it without having gone through all the answer choices. And then sometimes they'll get that question wrong. So doing it this way, starting from the bottom and working your way up, one, ensures that doesn't happen, and two, ensures you are not biasing yourself. So let's go ahead and do that now. Answer choice E, limits urinary dilution. D, increases urinary pH to greater than 8.0. C, increases calcium excretion. B, decreases potassium secretion by the collecting duct cells. And A, decreases alpha intercalated cell hydrogen ion secretion. So we're going to go ahead and open up that poll. Hopefully you guys are starting to answer those 3 different steps. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. So yes, we'll wait a few seconds for you guys, for all of you to select an answer. Remember that there is no penalty for guessing on test day, so you should never leave a question blank. And if you're unsure this evening of what the answer is, don't worry about it. Take your best guess. We're all here to learn together. And then afterwards, Paras will explain to us why the correct answer is indeed the correct answer and why the incorrect answers are incorrect. We'll wait a few more moments here. Once again, just a reminder that we do have a raffle at the end of the evening. This is at the end of the session, so make sure you stick around because you must be present to win. It looks like we have a pretty even split here. All right, let's take a look and see what all of you selected. In first place with 29% was answer choice E, limits urinary dilution. And second and third place were pretty close. So B was in second place and A was in third place. Let's take a look and see what the correct answer is. And the correct answer is E, and 29% of you got it right. So it was a challenging question indeed. Congrats to everybody who got it right. If you didn't, don't worry about it. Paras is going to explain it to us now so you can get it right on test day. Let's also make sure that if you got it right for the right reasons. Paras.
Thank you, Sean. Great job, guys. Definitely a tough question here. So yes, the correct answer choice E is E, limits urinary dilution. So let's take a look at that question again. So there's some important clues in that vignette that really help you pick up on what that drug is. And hopefully a lot of you picked up on the drug. So this patient has fatigue, hypokalemia, and hypercalcemia. So hopefully you guys picked up that this patient was started on a thiazide diuretic, okay? On the next slide, Sean has actually gone ahead and pulled up a table from first aid on thiazide diuretics. You can see there in the adverse effects, it causes hypokalemic or hypokalemia and also hypercalcemia. Its mechanism, it inhibits sodium chloride reabsorption in the early DCT, or distal convoluted tubule. This leads to a decrease in the diluting capacity of the nephron. So what does that mean? Well, thiazides block that sodium chloride transporter, okay? So it increases excretion of actually both sodium and potassium. So we are now having the blockage of sodium reabsorption, okay? Because normally when you reabsorb sodium without water in the DCT, that's how you generate a dilute urine. However, since you're blocking that step, you're limiting urinary dilation, okay? Or dilution, sorry. So you're limiting urinary dilution because you're not reabsorbing sodium from that DCT, okay? So that's why answer choice E would be the best answer. So let's take a look at the other answer choices, maybe what you guys were thinking there, and why those are not the best answer choices in this question. So answer choice D increases urinary pH to greater than 8. This is something that you would see with carbonic acid inhibitors, and that would actually also lead to metabolic acidosis. So not the best answer choice here, and I don't think it was highly selected. Answer choice C increases calcium excretion. This is actually the opposite with thiazide diuretics. They decrease calcium excretion, which is why you can get hypercalcemia. The drugs to keep in mind that increase calcium excretion would be loop diuretics, and that would cause more hypocalcemia rather than the hypercalcemia seen in this patient. Answer choice B, which I believe was the second most highly selected answer. So this mechanism of decreasing potassium secretion is seen with potassium-sparing diuretics, and that would lead to hyperkalemia rather than hypokalemia that we saw in this patient. So also not the best answer choice. And lastly, answer choice A, decreased hydrogen ion secretion from the alpha intercalated cells. This actually would not occur. You actually would have more secretion of hydrogen ions because you have elevated aldosterone that ends up happening in this patient. So that elevated aldosterone leads to, and as well as the increased sodium delivery in the nephron, that stimulates secretion of hydrogen ions even more. So that would actually be increased, and that would lead to metabolic alkalosis, which we know is possible with thiazide diuretics. So hopefully you guys were able to piece together, using the mechanism of hydrochlorothiazide, how it is able to limit urinary dilution and how you can thus cross off a lot of those other answer choices.
Well, great job, everyone. Great job, Paros. Wonderful explanation as always. It was a challenging question, but we're all here to learn together. Let's go ahead and move on now to our second question of the evening. Once again, the answer choices are covered up. That is by design, and we will begin by reading the lead-in. Which of the following is the most likely cause of the patient's current presentation? Which of the following is the most likely cause of the patient's current presentation? I'll give all of you a few moments here to let us know in the question box how many steps you think this question will require, and then we'll read the lead-in. All right, let's read that vignette. A 32-year-old man visits the clinic for routine follow-up. He has a history of gout, treated with colchicine, and HIV infection treated with antiretroviral therapy. His serum creatinine is 2.6, and urinalysis reveals hematuria and needle-shaped crystals in the sediment. A CT scan shows no renal stones. Which of the following is the most likely cause of this patient's current presentation? Once again, please start thinking about the important clues in the vignette and lead-in as I hand it off to Paris.
Thank you, Sean. So once again, we will go ahead and show you what we think are the important clues in the vignette and the lead-in. So again, demographics. We have a little bit of a younger patient now, 32-year-old male. We're given some medical history on him. It's always important to take note of that. Also, what are his treatments? Okay, so we know that he's being treated with colchicine, he's on antiretroviral therapy. These are all important clues. Okay, they give us some lab values, they give us some urinalysis results, and obviously you can see some positive findings, so it's important to take note of those. We also have the luxury of getting a CT scan finding, so that's obviously going to be important as well. So what's the most likely cause of the current presentation? Well, I think in terms of steps, I think one, we need to figure out what's going on with this patient. And then two, maybe what's the cause? So maybe a two-step question here. So let's take a look at those answer choices. So as you can see here, 5 more answer choices. And once again, I'm going to start at the bottom and work my way up to the top. Okay. Answer choice E, pyelonephritis. D, indinavir. C, HIV nephropathy. B, dolutegravir. And A, colchicine. So once again, we're going to go ahead and open up the poll. Go ahead and select the answer that you think is the most likely cause of this patient's presentation, and we'll talk about it in just a few seconds.
Excellent. Thank you, Para. So once again, we'll give you all a few moments here to submit your answer, and once about 2/3 of you have done so, we'll move on and unveil the correct answer. Remember that when you're reviewing questions, when you're doing practice questions, it's important to go through all the explanations and make sure you got it right for the right reasons, but also read the responses and the explanations for the incorrect answers, because there are good learning points there. And later on this evening, Jeff will show you our new format of explanations, which is very similar to what Boris is doing with us this evening, explaining this is a 3-step question. Here's the first step, here's the second step, here's the third step. I think all of you will really like what the team at QMAX and USMLE-Rx has done. We've had some great feedback, and we're looking forward to sharing with those of you who may not have seen it yet. So a few more seconds here. Let's take a look and see what you selected. And in first place with 39% was answer choice D, indinavir. So let's take a look and see if that is indeed the correct answer. And it is. So well done, everyone. We did a little bit better than we did on the last question, so we're making progress. Let me hand it off to Paras so he can explain to us why D is the correct answer. Paras.
Thank you, Sean. Nice job, guys. So this is answer choice D, or indinavir. So let's take a look at that question one more time. So this is a patient with gout and HIV, okay? So he is on colchicine, we're told that, but if you look at the vignette, they also are kind of tricky. They're just telling us antiretroviral therapy. They're not actually telling us which medication he's on. So we kind of need to do a little bit of detective work to figure out that he may be on a protease inhibitor, okay? So they're being kind of subtle with that. So nice pickup by you guys, okay? You can see there on the lab values that his creatinine is 2.6. So we know that is elevated, okay? Furthermore, in that question stem, we could see that the urinalysis shows hematuria and needle-shaped crystals, okay? They did tell us, however, that the CT scan didn't show a stone. So probably not a renal stone that's causing that hematuria and crystalluria. So what's another possibility? Well, crystal-induced nephropathy from indinavir. And on the next slide, Sean has actually gone ahead and pulled up a table talking about some of these protease inhibitors. And you can see there, indinavir is one. And you can see there that it can cause nephropathy, okay? Specifically, crystal-induced nephropathy with indinavir, okay? So the drug precipitates in the urine, and it results in obstruction of urine flow, and that's how you develop these symptoms, okay? Patients most at risk for crystal nephropathy are those who are volume depleted, so they should be drinking a lot of fluids, or if they have underlying kidney issues as well, okay? So let's take a look at the other answer choices and maybe why those were not as good in this question. Pyelonephritis, well, you know, some of the things that we need to diagnose pyelonephritis are bacteria in the urinalysis, white blood cells in the urinalysis, something about fever or flank pain, Nothing really given to us about that. Answer choice C, HIV nephropathy. You can get a type of nephropathy with HIV, but we would be looking more for protein in the urine or proteinuria, things that would suggest some sort of nephrotic syndrome, not what we're having here. Answer choice B, dolutegravir. This is an integrase inhibitor, and it is an important part of HART therapy, or highly active antiretroviral therapy. However, some of the adverse effects include elevated creatinine kinase, nausea, vomiting, things like that, not necessarily what this patient is developing. And then lastly, answer choice A. This is also not a known, common side effect of colchicine. Some of the things that you should be on the lookout for with colchicine include, most commonly GI upset, especially diarrhea, and then also importantly, colchicine, agranulocytosis, which colchicine can cause. So hopefully you guys were able to pick up on that subtle clue that this patient was on a protease inhibitor, and that was causing drug-induced crystal or crystal-induced nephropathy. So great job with this question, guys.
Excellent. Thank you, Boris. Once again, another challenging question, but hopefully we'll learn from it and we'll get it right on test day. I know we mentioned RX Coach earlier, and I want to kind of briefly talk about that now, but before I do that, I want to ask all of you a question. And we're going to wait until about 2/3 of you have responded. Keep in mind that the responses are completely anonymous, okay? How would you describe the results you are seeing after your study sessions? I am seeing great results and I am happy. The results do not match my efforts. I am plateauing, or I am spending too much time and falling behind. We'll give all of you a few moments here to respond, and keep in mind that these are completely anonymous responses. We just want to hear from you. All right, I see the responses coming in. We'll give you a few more moments here. I see some people joined recently, so I do want to remind everybody that we do have a raffle. So make sure you stick around until the end because you must be present to win. All right, well, let's take a look and see what everybody selected. And as you can see, it's a pretty even split, right? And about 1/4 of you are seeing great results and you're happy, but about 2/3 of you aren't, right? You're saying the results don't match your efforts, I'm plateauing, I'm spending too much time and falling behind. So we show you that for 2 reasons. First and foremost, so you know that you're not alone, right? A majority of you are not feeling 100% satisfied with your study effort. So don't ever feel like you're alone. Medical school can be stressful, but we're all in this together. But if you want that additional support, that guidance, that help of an experienced RX coach like Boris or Alec or Brian, you can subscribe to our service and we can help you individually one-on-one. All of your classmates are different. Everybody thinks differently. Everybody has different strengths and weaknesses. And for that reason, what your friend did may or may not work for you. What you read online may or may not work for you. A USMLE program where everybody's doing the same thing at the same time and expected to learn at the same pace may also not work for you. What we'll do is we'll administer one of our assessments, and we are one of the only tutoring companies, if not the only tutoring company, that has authored materials. We've been in medical education for 30 years. We've created our own assessments and have a proven track record. So once you take one of our assessments, we'll create a personalized study plan, and you'll work with one of our experienced RX coaches to implement that study plan, work on knowledge, work on content, identify your strengths and weaknesses, and of course, work on test-taking skills, as well as timing and stamina. We have a proven track record, even with RX Coach, with 4.9 out of 5 student satisfaction. And that's mainly because we have a lot of experience and our staff is very, very well trained, and we're very selective with who we hire. So if you're interested in receiving the help of one of these experienced coaches who has been through what you're going through and who likely is where you want to be in the future, reach out to us at rx-coach.com or rx-coach.com. Click on that free consultation tab. Now we can talk about the program and how it can benefit you, okay? That's rx-coach or rx-coach.com. And we don't just exclusively tutor for board exams. We also tutor students while they're in M1, M2, M3, M4. We work with them for in-school exams, block exams, for COMLEX, for USMLE Step 1 and Step 2. So no matter where you are in your medical education career, we're able to assist you. So if you want that extra push, you want that one-on-one guidance from an expert, You want to make sure that you're maximizing your potential and success on test day. We're here to help you, okay? So with that, let's go ahead and move on to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following best describes the mechanism of action of nitrofurantoin? I'll give all of you a few moments here to let us know in the question box how many steps you believe this question will require. All right, let's go ahead and read that vignette. A 21-year-old preemie gravida woman presents for routine examination at 37 weeks of gestation. A routine urinalysis reveals bacteria and white blood cells. She has begun on nitrofurantoin therapy. Which of the following best describes the mechanism of action of this drug? I'll give all of you a few moments here to start thinking about the important relevant clues, and I apologize in advance for butchering the name of that drug as I hand it off to Paras.
Thank you, Sean. So once again, we will go ahead and show you what we think are the important clues in that vignette in the lead-in. So, as you can tell here, starting to get shorter vignettes, and I think you'll start to see that going forward as well. But, importantly, demographics, so a much younger patient, but also being told that she's 37 weeks of gestation. Always important to take note of where they are in their pregnancy, because that can really clue you into certain diagnoses, what you need to be on the lookout for. They told us that she was started on a medication, nitrofurantoin, and we know, based off the lead-in, that this question really was just asking about the mechanism of action of that drug. Not a lot of else from that vignette really to make that diagnosis or to answer the question. So, how many steps is this question? Mechanism of action of nitrofurantoin? Well, I think you could argue that it's just a one-step question. I think, what is the mechanism of action? And so I think that's basically it. So let's take a look at those answer choices and see if that's kind of along the same line. So we have 4 mechanistic answer choices here. Answer choice D inhibits bacterial dihydrofolic acid formation. C inhibits DNA gyrase. B damages bacterial DNA. And A binds to 30S ribosomal subunit, causing defective cell wall synthesis. So once again, we're going to go ahead and open up that poll. Go ahead and of those 4 answer choices, select the one you think best describes the mechanism of action of nitrofurantoin. And we'll talk about it in just a few seconds.
Excellent, thank you, Paras. So we'll give all of you a few moments here for our third question of the evening before we move on to our last question of the evening. Answer choice A got cut off, so let me read that for you. Answer choice A is binds to 30S ribosomal subunit, causing defective cell wall synthesis. And the word synthesis got truncated due to character limitations. All right, so the response is coming in. A few more moments here. And let's take a look and see what you selected. Looks like we had a clear favorite with 52% of you selecting B, damages bacterial DNA. So let's take a look and see what the correct answer is. And the correct answer is, in fact, B, and more than half of you got it right. So well done, everybody. Let me hand it off to Paras.
Thank you, Sean. Great job, guys. Definitely a pretty deep pharmacology question here. So, this isn't as important to answering the question, but just a little pearl. Asymptomatic UTIs, which is kind of what this lady has, it's asymptomatic. She doesn't have any symptoms. Usually don't need to be treated, except there are certain couple times they do, and one of them is pregnancy. Okay, because having bacteria in your urine can put pregnant women at increased risk of developing pyelonephritis, and thus issues with the pregnancy. So premature infants, low birth weight infants. So that's a time when it does need to be treated, which is why she is started on this medication now. Okay. You do have a couple options in pregnancy, one of which is nitrofurantoin. Okay. So What does nitropharantoid do? Well, I think a lot of you guys picked up on it. It damages bacterial DNA as well as some of those ribosomal proteins, okay? And there is the development of kind of reactive molecules as well that damages that DNA, okay? Now, hopefully you guys were also able to pick up on, what some of the other answer choices were and what they were getting at, and maybe that's a way you could have crossed it off. So answer choice D inhibits bacterial dihydrofolic acid formation. This is likely getting at trimethoprim-sulfamethoxazole, okay? That is a drug that can be used for urinary tract infections. It is contraindicated in first and third trimesters, but hopefully you guys maybe picked up that that's what answer choice D was getting at. Answer choice C inhibits DNA gyrase. Well, this is probably getting at fluoroquinolones. Ciprofloxacin is something that's commonly used for urinary tract infections, okay? However, keep in mind that that is also contraindicated in pregnancy as well. It can cause cartilage damage, but that's probably what answer choice C was getting at. And lastly, answer choice A, this is probably getting at a couple things, maybe gentamicin, maybe tetracyclines. These are also contraindicated in pregnancy, sometimes can be used in urinary tract infections, but hopefully you were able to pick up on those, and then maybe from that we're also able to select answer choice B. So a pretty detailed pharm question here. Great job on picking up that this was answer choice B.
Excellent. Well, great job, everyone. Let's try to finish strong with our fourth and last question of the evening. Once again, the answer choices are covered up, and we will begin with a lead-in. Which of the following drug mechanisms best explains why amoxicillin is prescribed at a reduced dose in this patient? Which of the following drug mechanisms best explains why amoxicillin is prescribed at a reduced dose in this patient? I'll give all of you a few moments to let us know in the question box how many steps you think this question will require. Then we'll read the lead-in. All right, let's take a look at that vignette. A 40-year-old man comes to the clinic because of a 4-day history of pain in the left ear. His medical history is significant for gout, for which he takes ibuprofen, allopurinol, and probenecid. Otoscopy shows an erythematous, bulging left tympanic membrane. He is prescribed amoxicillin at a reduced dose. Which of the following drug mechanisms best explains why amoxicillin is prescribed at a reduced dose in this patient? And with that, I'll hand it off to Boris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette in the lead-in, okay? And hopefully by doing this, you guys can kind of get a sense for what we think are relevant clues to take note of and to highlight, so that when you go back and look back at the vignette, you really have all the important relevant information highlighted and can kind of maybe take not as much notice in some of that clutter around it. So hopefully you guys are able to pick up on what we think is important, and then also what to be looking for based off that lead-in question. So again, demographics important, and then specifically this patient's coming in with an ear issue. As you can tell, the lead-in was asking specifically about why amoxicillin is prescribed at a reduced dose, okay? So it's important to look in that vignette, look for anything there that can maybe tell you why amoxicillin was prescribed at a reduced dose, okay? So in regards to that question, how many steps is this question? Well, I think this is kind of tough. I think you'd have to maybe say two-step question. So what's going on in the patient, okay, that necessitates amoxicillin being prescribed at a reduced dose? And then two, what is the mechanism for that? So maybe a two-step question here, kind of a little tough, but I'd say two steps. So let's take a look at those answer choices and see what we're working with. So once again, we're going to go ahead and start at the bottom, and we're going to work our way up with those answer choices, okay? So answer choice E, inhibition of the organic anion transporter. D, induction of cytochrome P450. C, increased tubular reabsorption of antibiotics. B, decreased glomerular filtration rate. And A, competitive inhibition of xanthine oxidase. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
All right, well, this is our last question of the evening, so let's try to finish strong and make sure you stick around until the end to see if you win our raffle. We'll give all of you a few seconds here, and then we'll go over our special offer for all of you in attendance, the raffle, as well as our new features of QMax. All right, a few more moments here. All right, and let's take a look and see what you selected. For those of you asking what the topic is next week, the topic next week is cardiac pathology. Cardiac pathology. Well, looks like it was a pretty close one here. In first place with 23% was A, competitive inhibition of xanthine oxidase. In second place was with 21% was induction of cytochrome P450, and close third place was decreased glomerular filtration rate. So let's see what the correct answer is. And the correct answer is E, inhibition of the organic anion transporter. And 18% of you got it right, so this was indeed a challenging question. We've got a lot of challenging questions today, and if you're sitting there thinking, I knew that, I should have gotten it right, or if you just had a knowledge gap, remember, we are here at RX Coach to help you. So for now, pay attention to Boris so he can explain it to you, and we can all get it right on test day. Boris.
Thank you, Sean. Yeah, definitely a tough question here. So let's take a look at this question one more time. So number one, this is basically asking about why is amoxicillin prescribed at a reduced dose? Well, hopefully you guys picked up on the other medications this patient was on. He was on ibuprofen, allopurinol, and probenecid, okay? So let's talk about probenecid real quick. We know it is used to treat gout, okay? It inhibits the reabsorption of uric acid in the PCT, okay? And as you can see here, Sean has actually pulled up a figure. You can see that, yep, probenecid inhibits the reabsorption of uric acid, okay? However, it also inhibits the secretion of penicillin by the organic anion transporters in the PCT. And you can see there on the left is blood, in the middle, those are our tubular cells, and on the right, that is urine. So what ends up happening is that you get increased concentration of penicillin, such as amoxicillin. So probenecid increases the serum concentration of penicillin, thus oftentimes necessitates a dose reduction, okay? So as you can see here, the main reason why that was done is because of probenecid, and because it inhibits that organic anion transporter, which transports both uric acid and penicillin, okay? So that's why answer choice E was the best answer, and I know that's a tough question. Let's look at the other answer choices. I think there may have been a couple tough answer choices there. Let's see if we can help explain those. So inhibition of cytochrome P450, you know, this can raise some drug levels, but doesn't affect amoxicillin or penicillin. So CYP P450 not really at play here. Answer choice C, increased tubular reabsorption of antibiotics. Well, certain antibiotics like penicillin, sulfa drugs, they're actually secreted by the renal tubules, not necessarily reabsorbed. So I don't think answer choice C is the best worded answer choice there either. Answer choice B, decreased glomerular filtration rate. This patient is on ibuprofen, and that can decrease glomerular filtration rate, but that's not what necessitates a reduction in amoxicillin. Okay, so although it's true that ibuprofen can decrease GFR, that's not why the amoxicillin dose was reduced. And lastly, answer choice A, which I think was, if I remember correctly, was the second most highly selected answer. Competitive inhibition of xanthine oxidase describes allopurinol, okay? And allopurinol can cause increased levels of certain things, but not penicillins or amoxicillin. The thing that increases serum levels of penicillins is blockage of the OAT, or organic anion transporter, and that is inhibited by probenecid. So that explains answer choice E. Hopefully you guys were able to pick up on some helpful clues here today, and I will pass it off to you, Sean.
Great, thank you very much, Paris. Some challenging questions today, but a great job, and I hope everybody learned from it. These are the QIDs, or the question IDs, for the 4 questions we did this evening. You're welcome to take a screenshot or write these down, and if you type these into USMLE-Rx in the search field, you'll be able to pull up these questions. All 4 of these questions do have our new format of explanations, so you'll see every single step and the explanation of every step needed to answer these questions correctly. I'll give you a few more moments here to take note of these QIDs.